Have you ever wondered what it's like to be a nursing student during a clinical rotation? Well, let's dive right into it. Clinical rotations serve as the bridge between classroom learning and real-world application in the field of nursing. This stage of the education process is where students get to apply the theoretical knowledge they've gained in lectures and textbooks to actual medical settings. And it's not just about application, it's also about immersion. During these rotations, students are exposed to various departments within a hospital or healthcare facility. You could find yourself in pediatrics one day, comforting a child before a procedure, and in the surgical unit the next, assisting in complex operations. Or perhaps you'll be in the maternity ward, helping to bring new life into the world. Each of these departments offers a unique learning experience. In pediatrics, for instance, you'll learn about the specific needs of children and how to communicate effectively with them. In surgery, you'll gain insight into the intricacies of surgical procedures and the importance of precision and teamwork. Over in maternity, you'll experience the joy and challenges of childbirth and learn about postnatal care. Clinical rotations are designed to be immersive, challenging, and above all, educational. It's a chance for students to see firsthand the realities of nursing, the good and the challenging. It's about learning to balance compassion with professionalism, theoretical knowledge with practical skills, and independence with teamwork. As a nursing student, you'll get to see, do, and learn things that you simply can't get from a textbook. You'll be part of a team, working alongside experienced professionals who can guide you and help you grow. You'll also be making a real difference in patients' lives, even as a student. Clinical rotations are a crucial part of nursing education, providing students with valuable hands-on experience. They're not just about learning, they're about doing, growing, and becoming the best nurse you can be. So, what exactly do nursing students do during their clinical rotations? Well, let's dive right into it. The duties and responsibilities of nursing students during their clinical rotations are as varied as the departments they're posted in. But there are some common threads that run through all rotations, regardless of the department. Firstly, patient care is a significant part of a nursing student's responsibility. This could mean anything from taking vitals, to assisting patients with their daily activities, to providing emotional support. It's about understanding the unique needs of each patient and addressing them with empathy and professionalism. Now let's talk about administering medication. Under the supervision of nursing instructors or licensed nurses, students learn to administer a range of medications. They become well-versed in calculating dosages, understanding drug interactions, and observing patients for any adverse reactions. It's a high-stakes role that requires precision and a keen eye for detail. Then, there's documentation, a vital part of nursing that often goes unnoticed. Nursing students learn to record everything they observe and do. They document patient history, symptoms, medication times, and responses to treatment. This written record is crucial, not only for keeping track of patient progress, but also for communicating with the rest of the healthcare team. But it doesn't stop there. Depending on the department, tasks could range from assisting in surgeries in the OR, to providing newborn care in the maternity ward, to offering mental health support in psychiatric units. Each rotation offers a unique learning experience, exposing students to the wide-ranging roles a nurse can play. The beauty of these duties is that they are not just tasks. Each one is an opportunity to learn, to grow, and to acquire the skills that will shape you into an exceptional nurse. With every patient you care for, every medication you administer, and every document you write, you are not just performing a duty, but you're also building your future. Through these duties, nursing students develop essential skills that prepare them for their future careers. Clinical rotations aren't always smooth sailing. What challenges do nursing students face? Let's delve into this query. One of the primary challenges nursing students encounter is the physical and emotional stress tied to the job. The long hours on their feet, coupled with the need to be constantly attentive, can be physically demanding. This is compounded by the emotional toll that comes from witnessing the pain and suffering of patients, and at times, their demise. It can be difficult to detach oneself from the emotional side of the job, especially when dealing with children or patients who've been in care for an extended period. Another challenge is dealing with difficult patients or families. It's not uncommon to encounter patients who are uncooperative or even hostile. Additionally, family members can often be demanding, emotionally charged, or have unrealistic expectations about their loved one's care. As a nursing student, learning to navigate these complex interactions while maintaining professionalism can be a daunting task. Moreover, there's the challenge of balancing academic responsibilities with the demands of clinical rotations. Nursing students are expected to keep up with their coursework, exams, and assignments, all while dedicating significant hours to hands-on training in the hospital. This juggling act can lead to stress and burnout if not properly managed. Lastly, there's the pressure of making mistakes. The fear of causing harm to a patient or making a critical error can be a significant source of stress for nursing students. And while oversight is available, the reality is that mistakes can and do happen, making this a very real concern. Despite these challenges, clinical rotations are a valuable learning experience. They offer an unmatched opportunity to apply theoretical knowledge to practical situations, develop critical thinking and decision-making skills, and gain a realistic understanding of what a nursing career entails. While the road may be bumpy at times, the journey is definitely worth it. After all, it's these very challenges that shape resilient, competent, and compassionate nurses. So, what are the learning opportunities during clinical rotations? And what are the key takeaways? Well, clinical rotations offer countless learning opportunities, giving nursing students a real-world taste of what it's like to work in healthcare. It's not just about the technical skills, it's about understanding patient care in its entirety. This includes everything from bedside manner to managing medical records. It's a chance to see how all the pieces fit together, from diagnosis to treatment and beyond. One of the most important skills nursing students develop during clinical rotations is communication. Interacting with patients, their families, doctors, and other nurses is an essential part of the job. Through these interactions, students learn how to listen effectively, express themselves clearly, and handle sensitive situations with tact and empathy. Another key learning opportunity is the development of compassion. Nursing isn't just a job, it's a calling. It's about caring for people when they're at their most vulnerable. Clinical rotations give students a first-hand look at the emotional side of healthcare, teaching them the importance of empathy and understanding. Now, let's talk about key takeaways. One of the major lessons students learn during clinical rotations is the importance of teamwork. Healthcare is a team sport. Nurses, doctors, specialists, and administrative staff all have to work together to ensure patients receive the best care possible. Time management is another crucial takeaway. In a hospital setting, every second counts. Students learn how to prioritize tasks, manage their time effectively, and stay organized under pressure. This is a skill that will serve them well throughout their nursing career. Critical thinking is also a major component of clinical rotations. Nurses often have to make split-second decisions that can have a huge impact on a patient's health. Through their clinical experiences, students learn how to assess situations quickly and accurately, and make informed decisions based on their knowledge and training. Clinical rotations are a stepping stone to becoming a competent and compassionate nurse. They're an opportunity to learn, grow, and prepare for a rewarding career in healthcare. So, embrace the challenges, soak up the knowledge, and make the most of every moment. To sum up the journey of a nursing student during clinical rotations, it's a mix of purposeful learning, hands-on duties, and overcoming challenges. These rotations serve as a crucial pathway, bridging the gap between theoretical knowledge and practical application. They come with tasks that test endurance and skills, present hurdles that instill resilience, and provide learning opportunities that are invaluable. Clinical rotations are indeed a significant milestone in the journey of nursing students, shaping them into professionals ready to serve and care.